why is it important to connect communities of rural generalist practitioners around the world? Look, the truth is that generalism has been under siege in many of our countries and has been on the wane, and in a sense rural areas are the sort of the last healthy bastions of the practice of generalist medicine. I think that, and if we take only an in-country perspective, it's always hard. You're arguing sort of against the system with lots of perverse incentives, financing status, the status quo, and I think that that's difficult. I think that by combining at the international level with doctors whose work and commitment aligns to priority community needs, who share and have been solution finding, because they're nothing if not inventive, to share some of that, including data and strategy, data on impact and strategies for how to get there. Then I think that that's got the real makings of a sort of a much stronger international movement that will help on a worldwide basis, and I think is much stronger than the sum of its parts. So that's the importance, I think, of bringing together intra sort of country and sort of trans and international experiences into a single body of thought, and I have great hopes for what we might achieve by taking this approach.
So this inaugural World Summit on Rural Generalist Medicine, we're bringing together rural generalists from all over the world to talk about common challenges, opportunities and ways that we can learn from each other and support each other in practicing the medicine through the life course, the best medicine, the all-rounder jack of all trades medicine that we all practice, even though it comes under different names in different countries.
The summit's a fantastic first world grouping on rural medical generalism, or generalism particularly, and it's great to have international colleagues, Canada, from UK, New Zealand, Singapore, sharing together on this development. It's fascinating to see, in fact, the early developments of the resurgence of generalism as a necessary rebalancing in the medical profession, and particularly to be a way forward in terms of providing the services that our communities need, and doing that in a way which is very cost efficient.
The summit here in Australia is my first international summit. I've been to many summits in Canada. It's pretty exciting to hear other colleagues from around the world, their perspectives. And so far in the first three presentations, it's really been quite gratifying that one has built on the other. And so it is really interesting that we're coming to a common understanding of what generalism is all about. And that's what I would hope would come out of the summit in the end.
I practice as a family physician in the hospital-based family medicine department. It's a very interesting department in the kind of work we are doing. We are actually trying to bring the values of family medicine and practice it in a hospital environment, and to help the patients when they leave the hospital to transit safely back to the care of their family physicians in the community. So I work with a team of doctors and nurses and therapists, and really it's really a remarkable, fantastic team, and we hope that we can create a new model of care that would improve the continuity of care between the hospitals and the family doctors in the community.
We've known generalism has been a little light flickering on the hill for many years, and it's good to see that it's now started to be developed and fanned by interested parties, and the discussions from around the world are fascinating. I think it's interesting how we're all in the same place. We all realise generalism is essential to good medical function, and just to see how different people are developing their different programs.
So the session that I was just involved in included representatives from 4 different Pacific Island countries who all practice what we would recognise as rural generalist medicine in different contexts, with different challenges, but with common themes. And hearing the Pacific Island health professionals talk about a typical day for them, their responsibilities, their on-call requirements, and some of the challenges of the context in which they work was familiar to all of us.
But it's actually the opportunity to just hear different people's points of view, to link in with a whole lot of different people from different places with different ideas, broader ideas probably than in country, and just that opportunity to link in with those people and collaborate and really hopefully this will just be the start of something that's going to roll on.
In the Cook Islands, I work as a medical officer in the emergency and accident department, in the outpatient department as well. And we tend to sort of not have a pathway for that particular area. We've got specialty areas in terms of surgery, obstetrics, pediatrics, obs and gyn. And it's really an eye-opener to come here and to hear that there is a opportunity for us who want to specialize in general medicine to be able to sort of see where we can start and to also try and come up and develop a program for us, particularly in the Cook Islands as well as the Pacific Islands in general.
But rural generalism also for me as a specialist means that we as specialists ought to be looking at broadening the way we practice as well in our country areas. So even as a cardiologist I should have some broader skills in respiratory medicine, diabetes, stroke and perhaps renal medicine. Because they're very much related fields. There is a huge access problem to specialists in the country areas where I work, and looking at avenues to broaden the specialist involvement in rural generalism I think is important for me as well.
Emergency physicians are in fact specialist generalists, one of the group, and we're hearing a lot about them today. The general practitioners, particularly the remote ones, rural hospital doctors and emergency physicians. And sometimes I use the term that a specialist is somebody who knows more and more about less and less until he knows absolutely everything about absolutely nothing. So, you know, we're hearing that there's a lot of need out there for the generalist that's got a very broad area of expertise to complement those people that might be in metropolitan areas.
Look, I think it's been a really interesting summit. It had many of the things that we know are important in a mechanistic sense of what is it that is the style of practice, the issues facing doctors who practice a broad scope of rural generalist medicine in their communities. We learnt too from around the world, Australia and elsewhere, about the processes of admission or selection of candidates into training programs and indeed into universities and some of the importance of systems of mentorship and so on. So I think those mechanistic things I think and strategies I think are really useful. The things that I guess maybe at a different level that I think are important and that we often don't talk about are culture, so and identity, professional identity and identity formation. What's really clear is that whenever you get a group of rural doctors together from anywhere around the world, there's just a spark, a recognition, something about common commitment, and people that tend to be very committed to their communities, for instance. That's where the mojo comes from. But I think also something about altruism, humanism, pragmatism, perhaps a sense of adventure, matters that I guess are really speak to sort of culture. Some of that's learnt and modelled. Some of it, and this is perhaps the interesting thing, is perhaps part of the character and temperament of people who find themselves drawn to that style of medicine, and possibly are more suited and resilient in this. So I think that notion of culture, of shared approaches, of values, is perhaps something that should imbue all of our thinking around how we engage with, select, support, train and maintain in practice. I think there are so many other things too. I mean, I was struck, for instance, by the common issues faced in metropolitan areas with ageing populations, healthcare price inflation, the necessity of rationing, of meeting healthcare system needs. I think the information from Singapore in that respect is fascinating, and I think that we in rural areas could be well served by thinking more deliberately about the application of the extended skill set generalist model, the master generalist model, in metropolitan, larger regional centre environments, and I think that that's a necessary future if we're to maintain effective, affordable healthcare in universal health systems according to need. I guess the other thing I think is perhaps important, and that we've touched on more at the end of the day when we heard from some of our consultant specialist perspectives. The notion in particular of clinical practice networks or systems of care. ways in which we might approach care where we're not just thinking about individual practitioners, but the rural doctor nested in a rural generalist nursing, rural generalist allied health, the community healthcare worker, the broader team, and indeed the partnerships with communities around that. But I guess more particularly the relationship with consultant specialists around how the generalist medical practitioners, their consultant specialists and subspecialist colleagues can together with others comprise a system of effective, affordable and safe care without it being distilled down to the presence or absence of one particular craft group or one particular discipline group. And the example we heard on that was cardiology in South Australia. So look, I think a great day, lots of ideas coming forth, lots of agreement, extraordinary sharing across all of the countries present, striking really. And look forward to hearing more of the more, I guess, analytic and solutions finding process that we'll see over the next day.